Please welcome to the stage Professor Max Ortiz Catalán, Scientific Director of the Center for Osseointegration and Bionics.
Pleasure to be here. Amputations have a clear impact on the way we conduct activities in our daily lives. So how we move around, how we interact with the environment, getting dressed in the morning, making breakfast, using a smartphone. It's not so easy if you're missing a hand, and it's even worse if you're missing both of them. So I've dedicated most of my career to try to restore the function of a lost biological limb using an artificial one, employing bionics. And bionics is the combination between biology and mechatronics. Now, when you think about a prosthetic limb, you mostly think about the robotic part, the hardware, the motors, the batteries, the gears. For that to be useful, it needs to be connected to the patient. And the patient should be able to wear it comfortably and use the device reliably in daily life so he can accomplish the things they want to do. So we develop a human-machine interface that allows a prosthetic device to be connected directly to the skeleton and the nervous system. And the reason why you want to do that is because conventional way of attaching a prosthetic limb to the body is with a socket. What a socket does, it puts a lot of pressure in the residual limb, which makes it rather uncomfortable and often painful. So instead of doing that, what you can do is place a titanium implant inside the bone that will osseointegrate, and from there you can do a skeletal attachment that you can connect the prosthesis to. And in this way, the patients can wear the prosthesis the whole day in a rather comfortable manner. Now, when it comes to control, the way we control our limbs is there are brain signals that come from our brains to the nerves to the muscles, activate the joint. In an amputation, the joint is lost, but those signals are still coming down. So what we do is we place electrodes in the residual limb, we look at the electrical activity that comes down from the brain, and we apply machine learning, which is a type of AI, to decode the intention of movement. So then we get those signals out through the implant system and tell the prosthesis what to do. And that's for the control. For the sensory feedback, we place electrodes in the nerves that were severed by the amputation that used to be connected to the biological sensors that we have in our extremities. So when we're stimulating, patients perceive sensations coming from the missing limb, and now that space is occupied by a prosthetic one. So this is a patient using this technology. As you can see, it has a prosthetic limb. It's connected to her skeleton. There are electrodes implanted on her residual limb. She's trying to move the fingers, and there are sensors both in the thumb and the index finger that allow her to feel the soft or the hardness of those devices. So by doing that, she is able to sort them out accordingly. Now, probably the biggest contribution of our work to the field is that this prosthesis has everything contained. The patient doesn't have to have a backpack with a power supply or a computing unit. Everything is inside the prosthesis for her to use in daily life. Now, when you have an amputation below the elbow, you have several muscles you can extract information from. But if you go above the elbow, you only have two. And in this case, what we can do is rearrange the anatomical structures to be able to extract more motor information for controlling the prosthesis. So you take the nerves that used to go to the missing limb, you spread them in the different bundles or fascicles, and then you take some of them to innervate muscles that are still available in the limb that have no biomechanical function because there is no joint to move. And that works for some of the signals, but you don't have enough muscles. So what we do is also we bring small pieces of muscles, free muscles grafts, say from the leg, we transplant them to the arm, and then what we do is we place electrodes in all of those neuromuscular constructs. The patient tries to move, the signals come down, we run them through the AI, and then the patient can control more functions in the prosthesis. What you see here is a patient trying to flex and extend every finger of the missing hand. And here I dare to say that this was the first patient in the world able to control every finger of a prosthetic hand in the same way they will control the biological one. And this is only possible because of a combination of technologies. There is surgical reconstruction, it's implanted electrodes in the nerves and muscles that we run them through the AI, and then we can tell the prosthesis what to do. And this work has been focused on restoring function after an amputation. Unfortunately, for many of these patients, they will suffer something called phantom limb pain. And these are painful sensations perceived in the missing limb. It's as real as any other pain, and they're rather common and quite difficult to treat. For patients with severe phantom limb pain, the pain can be a bigger disability than the loss of the limb itself. If you've probably been in pain in your life, you know when you have pain, it jumps in priority very quickly. Nothing else matters. Some of these patients will perceive the limb in anatomically impossible positions. They're hard to fix because you can't touch the phantom. So I invented a treatment in which we use surface electrodes or electrodes placed on the surface of the skin. We use that to decode intention of movement. We use a conventional computer screen and a webcam so the patient can see themselves. And then what we do is we add a virtual limb. So this is augmented reality. Now, this patient can control that virtual limb in the same way they will control their lost biological one. And the purpose of doing this is get the patients to use the neural resources that were affected by the amputation, give them back their job, and disentangle them or separate them from processing pain. Now, if the objective is for the patients to do a lot of exercises with their missing limb, what we want them to do is to practice those movements so we can get them to do serious gaming. If you will see the missing hand, try to play that again. If you will see the missing hand, can get that playing. So the patient can control the virtual environment entirely by doing movements. So you rotate the missing hand to the left, the car goes left, rotate to the right, the car goes right. And this basically enables the patient that in half an hour, 1 hour, put a lot of repetitions, and that helps them to reduce the pain. So we have tested this technology in clinical trials around the world. We have seen them to be effective even in patients with chronic intractable phantom limb pain. And now what we're trying to do is help these technologies to be available in more places. I have been operated within a research environment which has limited a little bit of the reach of these technologies. And now I'm on a mission to try to get these technologies to all the patients that need them around the world. And that's why early this year I relocated to Ukraine, where the ongoing war has left over 100,000 people with amputations, with a higher incidence of phantom limb pain because of other factors related to the war. And what we are doing now is working with charitable medical foundations, NGOs, to provide this treatment to several patients. So we have helped dozens, but there's many more, and there's many more around the world. So if you'd like to join this effort, supported with donations or investments, you're very welcome to reach out. I'll be happy to talk to you. Thank you.